Epione Pain Management Center. ఇక్కడ మీ నొప్పులు శాశ్వతం కావు.
Hello, I am Dr. Minal Chandra, your pain physician. I am the co-founder of Epione Pain Management Center. And while I was talking about sciatica, a lot of patients keep asking me what is the medicine that you can take to bring down your pain. Now for pain, we know that it is the painkillers, the usual painkillers like the diclofenac or the combiflam or the paracetamol. So these are not going to help you if you are suffering with sciatica pain. Sciatica is something where the disc is coming out and it is compressing your nerve. So there is a nerve inflammation. There is some damages that is happening into the nerve. So there is a special class of medicines that is called as anti-neuropathics, which you have to take, which will help you in sciatica pain. Very commonly what we use is a preparation of pregabalin or gabapentin, which is available in the market very easily. But again, when you are choosing to take this, you cannot just go and get the tablets from the chemist shop. You need to have a proper prescription because it has to be used in a proper dose. Now your physician, once they ask you to take this tablet, they give you with the minimum dose and then they escalate the dose according to how much your pain is coming down or the pain is increasing. So it has to start with minimum dose and keep on increasing till the pain starts coming down. And these tablets initially for 10 days will not have any results. So most of the time what happens is when the patient doesn't start getting the result, they stop these tablets. So make sure that if you're using gabapentin or pregabalin or anti-neuropathic tablets, do not stop it, because you need to continue it for like 3 months or 6 months depending upon how you're responding to the pain. And for most of the cases, we have seen that in first 3 to 4 days, patient will have a lot of dizziness and drowsiness, and early morning you don't want to get up. So these symptoms is very, very common with such class of drug, but do not skip it, because these will get over in 3 to 4 days and then you will you will get comfortable with these symptoms. These symptoms will again subside in 3-4 days. So most of the time our patients tend to skip the tablet. But if you are suffering with sciatica, the impinged nerve need this tablet for a long time in a good dose. So do not stop it. If you have your symptoms which is troubling you more, do check with your physician. They may decrease the dose of the tablet. So these tablets have to be continued for at least 3 to 6 months. Sometimes even longer, but in a good proper dose. And usually, like I said, by and large do not have any side effects except for dizziness, drowsiness. Sometimes the patient may also have dryness of mouth and small symptoms. So your physician can change the other tablets available. So for a sciatica pain, it is anti-neuropathics that is going to help you and not the painkillers.